Mr. Nye, gentleman from Virginia.
Thank you, Mr. Chairman. Secretary of Work, I had the pleasure of attending recently a breakfast where you were the guest speaker, and you laid out and described for us the challenges that you're facing right now in terms of Secretary Gates' charge to look carefully at all your spending accounts and find ways to save some money, particularly looking in the overhead arena. And I offered to provide some ideas for ways that I thought we could do that, and that's part of our ongoing communication with you and the Secretary Mabus. But I wanted to note you were describing what Secretary Gates said in May, essentially said military spending on things large and small can and should expect closer, harsher scrutiny. And I think that's a reasonable statement given the fiscal environment that we're in right now. In fact, Secretary Mabus recently said, quoting him, "The expected level of resources over the near to midterm will not sustain every program and every program objective, warranting a willingness to consider trade-offs in even our most deeply held priorities. And there are no sacred cows. Everything is on the table." Do you agree with Secretary Mabus in that assessment?
Yes, sir, I do.
Okay. What I wanted to ask was, given that constrained environment and given the new charge that you've been provided by Secretary Gates, even subsequent to the QDR being released, and considering the fact that the proposed redundant nuclear carrier homeport in Mayport carries a price tag of approaching $1 billion, estimated, that 4 equivalent facilities exist in the country, including another one on the East Coast, and that theoretically, at least, those funds could be used for other priorities that are on our list. Getting to 313 ships, fixing all of our maintenance backlogs at the facilities and of the ships that we have in the fleet, strike fighter shortfall, all those things that are on that list, including every other priority. What I wanted to ask is, would you agree that those are the kinds of trade-offs that you have to consider?
Yes, sir. In fact, we're in the process of considering them for this budget submission, which I think you know is due up to OSD on the 30th of July. As we looked at Mayport, really it is, we believe the costs are far closer to about $589 million instead of $6 billion. And it is really stretched out over a long period of time. Between FY11 and FY15, it's a grand total of $239 million. So we don't, this is a cost that we believe is very manageable and does not in any way, shape, or form take away from any of the other higher priority goals in the department. We actually think it fits well within the guidance we've been given on the QDR and don't believe it will in any way, shape, or form cause a problem in any of the other things you mentioned.
Well, we can agree or disagree on costs, and oftentimes we do. And this committee has actually asked for, in this year's NDAA, some further studies into what all might be on the table that would lead to a good estimation of what that cost might be at the end of the day. But I think the bottom line of what I'm getting at here is we know there's a cost involved and it's significant. We know that we're in a very tight resource constrained environment and that we've got to make some tough choices and some tough trade-offs. And that's the charge that you're left with. That's the charge that I'm left with in terms of representing a district, but also taxpayer dollars and trying to ensure the folks that fund us that we're using that money as efficiently and appropriately as possible and making some of those tough trade-offs. I just want to note that recently Northrop Grumman announced that it's closing its Avondale shipyard due to excess infrastructure. In fact, they noted that since the Cold War, the size of our fleet has shrunk significantly, and they can't afford to keep open an extra facility. I know there are a lot of folks who would like to see that facility remain open. But again, that's a tough choice they had to make about facilities and what we're able to afford going forward. I just say that to highlight the environment that we're in, and I have made no secret of my position on this issue. I strongly believe that whatever the final cost, whether it's $1 billion or something in that time frame, or in that region, over time we can use that money on things that are more urgent and more pressing for our Navy. So I just want to close by urging you again in the strongest way I can to, as you've said, consider those possible trade-offs. Take a look at that project again, and going forward, carefully decide whether or not that's really the best possible use of our scarce Navy dollars. But I thank you all for your service. I understand what you've been asked to do is you've been asked to make some very tough, difficult choices, and we want to work with you in that process. Thank you. I yield back, Mr. Chairman.
Thank you, gentlemen. Before I call on Ms. Davis, Mr. Work, recently I asked the proposed price tag on a replacement vessel for the Ohio class submarine. Has the Navy done any studies on whether a replacement such as the Virginia class submarine can perform the same duties with obviously an alteration in the missiles and the ship somewhat?
Yes, sir, we have. Secretary Mavis, when he came aboard last year, and I were first given a briefing on how much this boat could potentially cost, this became one of his focus items from day one. For the last year, the AOA, the Analysis of Alternatives for the Submarines, has occurred. The judgment is that because we have elected to go with the B-5 missile, that using the Virginia is not the right way to go, that there's a much better and more efficient thing to exploit our existing infrastructure on a 42 or 43 foot diameter hull. But once that decision was made, Secretary Mavis has asked every single requirement, what is the basis for that requirement, and what is the thing that is driving the cost in the boat? I don't have a final answer for you, Mr. Chairman, but this is at Secretary Mavis's level, and I can assure you that we will have an affordable boat that we can afford in the 20s.
Well, what's interesting, based upon your testimony today, the missile's driving the boat. Have you asked engineers to redesign a missile that might fit on a Virginia-class submarine? This isn't brain surgery. Have you done that?
So I'll have to come back and see if we have done an actual costing, but at the office of the Secretary of Defense level, it really was, can we afford to design a whole new missile now? And the decision was to stick with the D5 through about 2040. And that will sustain our solid rocket motor base industry. It will take advantage of all of the investments that we've had up to this point. And we believe that is the most inexpensive and the right way to go.
We may be of some help to you on this and help you with a decision, Mr. Work, because it appears the replacement of Ohio submarine is just phenomenal and might well eat into your attempt to reach the 313 ships that we want the United States Navy. I think you ought to ask the engineers about a missile that might fit in a smaller submarine rather than the multi-billion dollars you might have to sink into a replacement for the Ohio class submarine. We're talking about efficiencies.
Sure, Mr. Chairman.
Ms. Davis.
Thank you, Mr. Chairman. Thank you to all of you for being here and for staying, and a special welcome to Secretary Conklin. Good to have you here. Thank you. I understand that the department and the individual services are looking very, very hard to cut whatever programs are possible, and clearly understood. And I think that we should be doing that. I also understand that we're looking for some efficiencies, and hopefully some of those might even go into quality of life programs for our military personnel and their families. But I am concerned that we may be cutting or even eliminating some programs that are extremely valuable. And I wanted to talk for just a moment about the MyCAA program, the career accounts for our military spouses, career advancement accounts. That program has been wildly popular, as we know. And I wanted to ask, particularly Ms. McGrath, if you could help me understand better the process for weighing programs like that, which when compared to other programs are relatively small dollar amounts, and yet we have many far larger ticket programs out there that gain a lot more attention. But this one in particular, I think, is important to many. So what is it that we are really specifically looking at here? It's been scaled back and may, in fact, not have nearly the impact that it could have had with a relatively small, larger dollar amount.
Yes, ma'am. We've been talking this morning about obtaining efficiencies across the Department of Defense. We're looking at, and I think it's been mentioned by everybody here, we're looking at everything we do, how we do it, and are we optimizing our performance the way we currently execute today. So major programs, organizational structures, are there better ways to execute? And then when the decisions are made, it is through a very, what I'll call an analytical process where all of the submissions are brought together and every aspect is looked at, both from efficiency, effectiveness, quality of life. Things like wounded warriors certainly would be maintained. We are not looking to degrade, quality of life. But I would say that we're looking at every aspect of what we do when these decisions are made. And so it is not just about trying to save $1 or move things exactly from support to infrastructure without the input of quality and quality of life for our service members and their families.
Does the impact and the popularity in many ways of a program, I've had spouses tell me of all the things they have been looking at over the years, all the programs that are offered, this one resonated more than anything else. And I would submit that I think it's worth a second look in that program. And I appreciate your response. We're going to nudge on that one because it clearly can make a difference down the line. And I think by so narrowing the program and what's happened in the last directive, we're going to be missing out on a lot of the kinds of opportunities that many of our families might be entering into, which is going to turn around and help the services in the long run. And I don't think this is the time to lose out on those opportunities. I also wanted to just raise one other issue, if I may, within the time that I have, and that's for you, Secretary Work. If you could just speak for a moment, because Admiral Roughhead had said that predictable ship procurement allowed the industry to stabilize its workforce and retain the critical skills necessary to national security. And Admiral Mullen also has noted earlier. And in light of that, when we look at the MLPs, the mobile landing platforms, being spread out over a period of 5 years versus 3 years, which does not maximize the workforce, how do you look at those programs and try and make those decisions? Because I think we certainly have a strong example or two of where pushing that, the opportunity to move within a 3-year period would make a huge difference in terms of maintaining the kind of people that we need to be involved in those programs.
Yes, ma'am. Secretary Mavis is committed to maintaining 10 ships across the FIDA, 10 ships per year across the FIDA, 50 ships per year. And within the balance of the resources that we can put to the new ship construction. And we have to make these choices every day. More often, sometimes we do have to go to every other year procurement, but in this case we work directly with NASCO, for example, to work out with them on how they could achieve favorable rates using this existing legislation. And we will continue to work with the industrial base in every case to try to work through in the most efficient and effective way, given the limitation of resources and the priorities that we're trying to balance across the department.
Thank you. I know they're difficult questions and issues, but I think in the long run the taxpayer will be saving if we can figure out a better way to do that. And I'd like to yield to my colleague, Mr. Nye, for my remaining time.
I want to thank Ms. Davis for her interest in the MyCAA program and just follow up by saying I also think the program has provided some tremendous value to our military spouses. And earlier this year, I was contacted by a number of spouses who complained that the program was changed without a lot of notification to them. And I want to urge you in your review of this program to please do as much outreach with the military spouses as possible to hear their views about it before you make changes. Thank you.
Thank you.
Thank you, Mr. Speaker. Mr. Chairman.
Thank you very much. Does any other member wish to ask a question? Ms. Bishop.
Thank you for staying around so long. You timed it very well. Ms. Conant, I'm extremely happy to see you here again in your current position, and I want to thank you for all the service you gave to us, both when you were in charge of the Minority Council and then the Majority Council. I wish you best in this new endeavor as well. I am also most familiar, I suppose, with the Air Force bases, and I realize that we have a lot of infrastructure needs in all military, especially the Air Force right now, and especially with the MILCON process that we have. One of the ideas that this committee has long promoted for years is the concept of enhanced use leasing, which tries to leverage private sector dollars along with the military spending to try and utilize or underutilize properties that may belong to the DoD for the benefit of both the private sector as well as for military spending. I know in my area, Falcon Hill Project, which is extremely important, we're looking at maybe $500 million worth of money, revenue that can come to the Air Force over 30 years for needed infrastructure development. So I guess a couple of questions on that line. What is the Air Force position going forward about promoting and fostering enhanced use leases as a tool to help bridge the gap between the lack of MILCON resources and the need that is out there?
Thank you, Mr. Bishop, and I appreciate the opportunity to continue what's been a dialogue with you and other members of your delegation on this issue. I think enhanced use leases are a very important tool as we look at how to best invest our MILCON dollars, so I'd agree with the premise of your question.
Does the Air Force have a process or a system in place to help review potential problems with EULs or to recommend to Congress any legislative fixes or authorities that may be needed to promote them?
Sir, I'd like to get back to you, I think, with a more precise answer for the record about any additional needs that we might have there. I guess all I'd say in a general sense is that I think the dialogue between these committees and the services and between individual delegations and the services is critically important on this, and I'll get you a more detailed answer for the record.
That would be fair, and I think also better for me as well as the Department or the Air Force in this case, with a more detailed answer later on to that question. I'm making the assumption that you have not experienced any institutional resistance from the Department of Defense in fostering an EUL.
Sir, not that I'm aware of. As you know, there are a number of enhanced use leases that are very complex and complicated in their specifics, and so the Air Force staff has been working to talk through those issues that might be of concern to OSD, recognizing that some of these instances are more complicated than others.
In every effort where we start something that's a little bit innovative or new or different, there are sometimes institutional concerns or problems that probably can be easily worked out if our mindset is that we want this to be successful from the outset. And I think I appreciate you saying very clearly that this is one of those vehicles that we can use to try and move forward into helping some of the infrastructure needs that we have, and I appreciate your positive answers. I look forward to the more complete answer, and I look forward to working with you in the future. Thank you.
I do as well, sir. Thank you.
Yield back.
Thank you, gentlemen. Ms. McGrath, what progress has been made in addressing the items on the GAO's latest high-risk list for the Department of Defense?
So as I mentioned in my opening statement, we address the high-risk areas not as sort of an additional thought, but as our everyday thought. They're included in our strategic planning document for the business space, which is the strategic management plan. They are all aligned within those 4 goals. So we take proactive measures to address them each day. Each one of the high-risk areas has a plan identified, has appropriate governance in place. We utilize the Defense Business Systems Management Committee to review each one of the high-risk areas. We meet with the Government Accountability Office frequently on each of the areas, in addition to the Office of Management and Budget, to ensure that we are keeping our eye on the ball. We also have identified milestones and measures for each one of them, and we track performance quarterly through the DBSMC. So I would say I mentioned some specifics on the personnel clearance reform. We have made certainly a lot of progress there. The management attention, the plan, the proactive measures, all our tools we need to actually make progress on each one of those, and I believe that we are making progress in each one, and I'm happy to talk about any of them in specific detail, or just talk in the general terms about where we are.
The Subcommittee on Health will come to order. Today, the Subcommittee will consider the following bills: H.R. 903, the Dental Emergency Responder Act; H.R. 1745, the Family Healthcare Accessibility Act; H.R. 2923, the Combat Methamphetamine Enhancement Act; H.R. 3199, the Emergency Medic Transition or EMT Act; H.R. 3470, the Newborn Act; H.R. 5710, the National All Schedules Prescription Electronic Reporting Reauthorization Act of 2010, or better known as NASPR; H.R. 5756, the Train Act of 2010, that's TRAIN, and H.R. 5809, the Safe Drug Disposal Act. Pursuant to Committee Rule 9, the Chairman and Ranking Member will have 5 minutes each for opening statements, and any other subcommittee member who wishes to make an opening statement will be recognized for 3 minutes. And I'd start out by recognizing myself for an opening statement. The markup today on pending public health legislation is a result of great cooperation between the majority and the minority. I want to thank our ranking member, Mr. Shimkus, for his leadership and the time he and his staff have spent getting us to consensus today. I do want to note that there are many other good bills by members of this committee that remain under serious consideration for action in this Congress. We're going to continue to review the legislation and seek to move them as soon as possible. Many of you approached me about your bills. We will certainly convene another markup by the subcommittee in September as soon as we come back. We may also see if there's time left next week to do another subcommittee mark, but I can't promise that for sure. It depends on the full committee schedule, but we're going to try to do that as well. But certainly we'll do it as soon as we come back in September, or do both. Today we're marking up 8 pieces of legislation that will strengthen our capacity to respond to emergencies, arm us with the resources needed to fight prescription drug abuse, and improve our healthcare workforce in community health centers, as well as provide us the services to those on the autism spectrum. Again, I want to say that I'm pleased that we were able to find consensus on the bills. Only consensus bills are being considered today, and I look forward to reporting them to the full committee and then to the floor. We're not just reporting them out here. We're obviously trying to move to the full committee and to the floor as soon as possible. And I now recognize our ranking member, Mr. Shimkus.
Thank you, Mr. Chairman. As with our legislative hearing this morning, I believe this expanded list of bills we have for consideration represents mainly bipartisan projects. Once again, I think it is a great example, as you said earlier, of us working together, just really getting staff in the room to work out the gritty details of language, which sometimes we have different views and we can learn or we can help modify. I support passage of these bills. Look forward to working with you. Sometimes in this environment, we diminish what we do here by saying, it's just an authorization bill. In this environment that we live and work in, authorization bills do give the right to spend money to future spending. It's not the actual spending, as we know. It's an appropriation process, but it does start the process of additional spending. Some of these bills are reauthorizations, and if they're not greatly increasing that amount, that causes less concern. We have some new authorizations which really cause us conflict in this environment. And one of the bills that we may bring next week or a couple weeks, I was approached by a member on the majority side, good friend. Want to be supportive, but it's tough to do new authorizations in this environment, and I think that's what we need to work through. We also are addressing some new authorizations that have to that are doing the same thing as some was previously done in the federal government. And in one case, we've got one where there is a committee that's supposed to be doing what we're going to authorize a new committee to do, but we have to take away the old committee status and reestablish a new committee to do the thing that the old committee should be doing. I would rather us just bring in the old committee and ask them, and why aren't they getting appointed, and why aren't you doing what we've established you to do? But that's bottom line is we can work through all that. Again, we work real well. I want to help this to go expeditiously, and I yield back my time.
Thank you, Mr. Shimkus. Next, for an opening statement, recognize the gentlewoman from California, Ms. Eshu.
Thank you, Mr. Chairman. I especially appreciate your bringing up these bills for markup today, and also what you said in your opening statement, which is hopeful. I'm one of the members that is hope against hope that we can get the arthritis bill out of the committee. I mean, here's a bill that has 175 co-sponsors, almost 50 Republicans on it. So we passed this in the last Congress. Unfortunately, the Senate didn't never voted on it, but it passed through the House with unanimous consent. And we've worked on the bill, and I'm saying this very purposefully so that my pals on the other side and their staff know that we've reworked the bill so that there are not any redundancies between the health care bill that we passed and the arthritis bill. Suffice it to say, this is something that impacts many, many Americans. And there's not a Republican form of arthritis or a Democratic form of arthritis. This should be a source of pride to all of us. So I'm very anxious to do anything and everything that I can in working with minority staff, majority staff, the chairman, the ranking member, whomever you want to put in front of me. We should really get this done. So I appreciate what you said, Mr. Chairman, and I hope that this bill is in one of those columns that you mentioned in your opening statement, and I look forward to...
The gentlewoman yield?
I'd be glad to.
I just want to say it is one of the ones that we're trying to get moved and have considered.
Great.
And it's also one that I'm very supportive of.
Good. Well, thank you, Mr. Chairman, and I'll yield back. I look forward to voting on the bills that are before us today, and thank the authors of the bills for their work, and yield back.
Thank you. Next is the gentleman from Pennsylvania, Mr. Murphy.
Thank you, Mr. Chairman. We know every family needs a medical home, but 56 million people live in a community without easy access to a doctor. There are doctors who want to help, but significant barriers prevent physicians and other medical professionals from volunteering at the over 1,200 nonprofit community health centers providing vital primary care to 20 million Americans. Further, there are many counties in America with no community health centers at all. These critical facilities save nearly $18 billion a year for the nation's $2.5 trillion system because a patient seen in a community health center is one less person crowding an emergency room and one more person being helped by prevention or prenatal care or a child's checkup. But with a shortage of doctors and shortage of community health centers, no doctor means no health care. The Family Health Care Accessibility Act, introduced by Congressman Green and myself, encourages doctors to volunteer their skills at community health centers. Currently, a doctor, psychologist, dentist, or someone else who volunteers at a free clinic or is employed at a community health center, they're covered under the Federal Tort Claims Act. But if they are employed at a free clinic or volunteer at a community health center, they're not covered and have to provide their own medical liability insurance, oftentimes costing tens of thousands or over $100,000. Health centers are about to take on an even greater responsibility of care for our nation. By 2015, health centers will double the number of patients served to 40 million. That leaves still 16 million people living in an area without access to primary care. Although patients at community health centers are rapidly growing, the number of physicians is decreasing, and last year more than 3,400 primary care physician positions were unfilled. The Journal of the American Medical Association noted that 13% of family physician positions at community health centers are unfilled, such as internists, OBGYNs, and psychiatrists. Extending medical liability protections to volunteer physicians would result in more doctors and more patients being served at a lower cost to these centers, and the cost to do this is pennies on a dollar. It is estimated that extension of the FTCA protection would cost the federal government just $1.5 million a year, but it would serve millions more new patients. So once again, I'd like to thank Representative Gene Green and you, Mr. Chairman, and Ranking Member Shimkus for bringing this legislation up for vote. It clearly will improve the lives of millions of families in our communities and ensure doctors who want to help finally can. And I yield back.
Thank you, Mr. Murphy. The gentleman from Texas, Mr. Green.
Thank you, Mr. Chairman. It's appropriate. I'm following Dr. Murphy. I want to thank you for holding this markup on several pieces of legislation, and particularly H.R. 1745, the Family Health Care Accessibility Act. Representative Murphy introduced this bill for years, and I've worked with him to move it out of the House a couple of times. Unfortunately, the Senate's been unable to move the bill. The legislation is crucial to our community health centers, especially following the passage of health care reform and our increasing reliance on the FTC to provide primary care. H.R. 1745 will extend federal tort claims coverage to licensed volunteer practitioners and FQHCs. I've heard from so many physicians, dentists, nurses who would love to volunteer their services in our local FQHC, but leery to do so because they do not have the FTCA coverage. If we continue to rely on FQHCs, we need to increase the number of healthcare providers in our federally qualified health clinics. It is difficult for FQHCs to hire practitioners, but so many qualified individuals want to volunteer their time to help. This legislation would allow licensed practitioners to volunteer and provide them adequate tort claims protection that is equal to the employees of the federally qualified health centers. And again, Mr. Chairman, thank you. I yield back my time.
Thank you, Mr. Green. Next gentleman from Pennsylvania, Mr. Pitts. He waves. The gentlewoman from North Carolina, Ms. Myrick, waves. Gentlewoman from Tennessee, Ms. Blackburn.
Thank you, Mr. Chairman. Overall, I'm pleased with the intent of the bills being presented to us today. I think that there are many opportunities to improve public health, and there ought to be, and these are steps in the right direction. They do need to have a little bit more work on them, especially the issues of infant mortality, where I have spent a good deal of time working on that issue in Shelby County, Tennessee, and of course the work we've done on curbing illegal prescription drug use. They are critical to my state. And while I appreciate the efforts in these important pieces of legislation, I continue to believe that time in this committee would be well spent, could be well spent addressing the effects that Obamacare is going to have on this nation. Because Obamacare, we're already seeing, has placed an unprecedented financial burden on small businesses through premiums, increases, the piles of additional paperwork, the extra taxes that are going to be included in the new health care reform bill are now going to be over upwards of $500 million coming right out of the gate. But this is all something that isn't constituting health care reform. It is just a shift in focus to government control. And I think it's important to look at what happened in Massachusetts, what is happening right now. Companies are dropping their health coverage for employees and asking them to go on the state-subsidized care because it's just too expensive for the companies to continue to afford. And as I have told this committee on numerous times, the same situation played out in my state through TennCare, which was the test case for public option health care. It promised increased coverage and a reduction in cost. Of course, it nearly bankrupted the state. So we need to heed what is happening in Massachusetts, what has happened, did happen in Tennessee, and begin to address that law and make some much needed changes, and I yield back.
Thank you. Next is our Vice Chair, the gentlewoman from California, Ms. Capps.
I'm only going to say one thing because two things. I want to thank my colleagues for working on these important bills. I will support all of them. But my colleague from California, Anna Eshoo, gave me a notion to another item on the agenda for a future bill to get my Heart for Women bill here before the committee. It has passed this House before, as I know you know, Mr. Chairman, and it's common sense. It's bipartisan, has 167 co-sponsors, so maybe this will set a tone today that we can do some of these bipartisan pieces of legislation that are important, and I know we've been preoccupied with other things, but now we have a chance to get some of this work done, and I applaud that opportunity and look forward to it. And I yield back.
Thank you, and I just say the same that I said before, which is we're certainly going to try to move some of these bills, and I know you have, so I don't have to say that bring them to our attention on both sides of the aisle, and we'll see what we can do. Next is the gentleman from Georgia, Mr. Gingrey.
Mr. Chairman, thank you. All of these bills that we're marking up are, I think, real good bills, and I must say I was a little disappointed to not know about them in a little more timely manner. I'm kind of obsessive compulsive. I guess most members of Congress are. Certainly, physician members of Congress definitely are. But you like to read these bills and understand the issue. And but like I say, I early this morning I had a chance to go over all these bills, and I think they're good. I really do. And I'm going to be supporting the legislation. It's done in a bipartisan way. But I agree with my colleague from Tennessee, Ms. Blackburn. This committee needs to be looking here 3 months after the passage of Obamacare, looking at the unintended adverse consequences. I think Ms. Pelosi was right. She said we need to pass this bill so we can figure out what's in it. And as I go across my district, I had a town hall meeting last night, calling back to my district from up here in Washington, and I asked them. I said I'm going to take a poll, and I want to know what is your greatest concern. And here are the three choices: illegal immigration, Obamacare, or the budget debt and deficit, the amount of money we're spending. Or if you're equally concerned with all three, push number 4. And I think about 85% selected number 4. Clearly, the American people are very, very concerned with Obamacare and the unintended consequences and what it's going to do to our manufacturing environment and loss of jobs. And I talk to small businessmen and women all the time, and they're saying, well, we're not in a situation of uncertainty and not knowing, and then actually knowing at a date certain some of the things that the shoe that's going to fall. They're not going to hire people, and no wonder our unemployment rate is still 10% and rising, and we have 16 million people out of work. So. I'm going to yield back my remaining 30 seconds, but I agree with the gentlelady from Tennessee. That's what we ought to be addressing here on this committee. Thank you, Mr. Chairman.
Thank you. Gentlewoman from Wisconsin, Ms. Baldwin.
Thank you, Mr. Chairman, for holding this markup. And I wanted to restrict my comments to just one of the pieces of legislation on the agenda, the Safe Drug Disposal Act. I want to commend you and Mr. Inslee and Mr. Stupak for working so hard on this issue. As you know, the safe disposal of drugs is of increasing importance with the rise of the abuse of prescription medications. But it is also of great importance because of concerns about what happens when the drugs are disposed of improperly, generally meaning flushed down the toilet or sinks. As my constituents, or as my colleagues who sit on the Energy and Environment Subcommittee know, I am particularly focused on ensuring that our nation's drinking water supply is free of the presence of pharmaceuticals and other personal care products. In 2008, the Associated Press found pharmaceuticals in the drinking water supplies of approximately 46 million Americans. A vast array of pharmaceuticals, including antibiotics, mood stabilizers, and hormones, were found. I included an amendment to study this precise issue to the AQUA Act, which passed out of this committee just a couple of months ago. The amendment provides that EPA study prescription drugs and other personal care products in our water, including their source, the effects they have on our health, environment, and drinking water, and how to prevent their presence altogether. Today's bill complements those efforts by asking EPA to further study the complete environmental impacts resulting from the disposal of controlled substances. It also asks EPA to review its authority and determine if the agency needs additional authority to implement recommendations for safe disposal. I believe this bill takes steps in the right direction towards reducing prescription drug abuse and also removing pharmaceuticals from our environment, including our water supply. I urge my colleagues to support this measure as well as the others on our markup schedule today, and I thank you, and I yield back the balance of my time.
Thank you. Gentlewoman from California, Ms. Harmon.
Thank you, Mr. Chairman. I'm sort of getting the idea that we're doing opening statements and then we're going to race through these bills. Am I correct?
That is correct, I hope.
Okay, then let me race through my opening statement so I can spare everybody my brilliant prose a little later. I'm going to introduce an amendment in the nature of a substitute to the EMT Act with support from our colleagues, Mr. Sarbanes and Mr. Bouyer. This bill was adopted by the committee as part of the Health Care Act, but because we passed the Senate version, it was left out. And let me just make a few points about why this matters. The unemployment rate for returning vets is about 28%, at least twice the national average. Many of them come back with really finely honed skills as medics, and yet they have to go to the bottom of the line with everybody else to become trained first responders. This bill would give them assistance and the ability to skip stuff they already know in training to be first responders, and that would help us in two ways. It would employ them and show our gratitude for their service, which is useful. It would also be a really big deal for communities that need surge capacity in the event of natural disasters or, let's hope not, but it's possible, terrorist incidents. So this is a bipartisan, wonderful piece of legislation, and I commend you for including it today, and I urge its enactment when it is brought up in a few minutes, and I yield back. Thank you, Mr. Chairman.
Thank you. Gentleman from Georgia, Mr. Barrow. Waves. Gentlewoman from Florida, Ms. Castor.
Thank you, Mr. Chairman, and to my colleagues for working on these good bipartisan bills. Mr. Chairman, I'd like to put a plug in for the breast cancer package. There are a number of bills we had a hearing on already that they could easily move through committee with bipartisan support, including my Eliminating Disparities in Breast Cancer Treatment Act. So thank you for allowing me to do that. And I'd like to thank all of my colleagues for particularly working on 5710. Mr. Whitfield, Mr. Pallone, this is the one relating to prescription drugs, because Florida is awful. We are a real problem child in Florida, and I'm the first to admit it. We finally just adopted in our legislature a monitoring system, and this prescription drug abuse is an epidemic. 5,000 people in Florida die per year. Here's a great statistic for us. Of the nation's top 100 doctors who dispense oxycodone, 92 are in Florida, according to the DEA. Just great. And at the end of May, the Tampa Police Department went out and raided all of these pain management clinics. They're on every other corner in the Tampa Bay area. And they have cars and vans with out-of-state license plates just parked in the parking lot. People are floating all around the neighborhood, and they went, and thank goodness local law enforcement was raiding these clinics. But we've got to do everything possible. From the St. Pete Times, after the big raids, they said neighboring businesses celebrated as though released from bondage. But, even the day after the raid, people came back and were parked in the parking lot and lining up outside these pain clinics. So what the committee's trying to do to provide states with additional resources to tackle this problem is very important. So with that, I'll yield my remaining time to Mr. Green from Texas.
Thank you. Gentleman from Maryland, Mr. Sar. Oh, you're yielding to Mr. Green. I'm sorry. Go ahead.
Yes, sir. I just wanted to say, and to my good friend from Georgia, I know people are concerned about Obamacare, but since we spent hours and hours on this, I would hope it would be called the Energy and Commerce Committee, because I don't remember any amendment we put on this bill that had President Obama's name on it. So some of us are proud of that health care bill, and you know, like any legislation, we have to revisit it on a regular occasion, and we'll have to do that. And some of the bills today are things that the House put in that the Senate did not do. And so we're trying to correct, again, Senate lack of effort on health care. So, and I thank my colleague from Florida for yielding me time.
Gentleman from Florida has the time.
And I yield back.
Yield back. Next is the gentleman from Maryland, Mr. Sarbanes.
Thank you, Mr. Chairman. And these are 8 very good bills, and I look forward to voting for them today. I did want to echo the comments of Congresswoman Harman with respect to the Emergency Medic Transition Act. I've enjoyed working on that bill with my colleagues at a time when there are shortages across our healthcare workforce. Anything we can do to more rapidly deploy resources to meet the demand is something we ought to pursue, and this is a terrific way of doing that, recognizing the training and experience that these medics have had and helping them move more quickly through the licensing process and otherwise navigate the rules and regulations when they come back, so we can get them deployed quickly to respond to people's needs. I also wanted to mention the importance of the Family Healthcare Accessibility Act, again, at a time when we have a shortage, particularly in primary care providers across the country, and want to make sure that these community health clinics have the adequate level of staffing to meet the demand for their services. Finding a way to make it easier for volunteers to come into those settings and deliver care, I think, makes a lot of sense, and that's what H.R. 1745 does. So those 2 bills in particular I wanted to speak to, but all of them today are good bills, and I'm looking forward to supporting them, and I yield back my time.
Thank you, Mr. Sarbanes. And Mr. Space, the gentleman from Ohio.
Thank you, Mr. Chairman. I'd like to thank you and Ranking Member Shimkus for your work on these respective pieces of legislation, all of which are worthy. And I just want to, I guess, put in a plug, as it was phrased earlier, for 5756, H.R. 5756, dealing with autism. And specifically, a significant part of this is early intervention. Autism has become epidemic in our country. And the sad fact is that oftentimes it goes undiagnosed for far too long, and after diagnosis, untreated. And studies have proved conclusively that through early intervention, not only can we enhance the quality of lives of those who suffer from autism and their families, we can save a lot of money on the back end by helping make these individuals much more productive members of our society and live a much more productive and full life. Again, I want to commend you, Mr. Chairman, as well as Mr. Shimkus, and members on both sides of the aisle for working together on what we see as very worthwhile and important legislation. I yield back.
Thank you, Mr. Space. I think that concludes our opening statements, so we'll move to consideration of the bills. And the first we're going to call up is H.R. 903, the Dental Emergency Responder Act. I would ask the clerk to report the title of the measure.
H.R. 903.
Without objection, the bill will be considered as read and open to amendment at any point. We now recognize myself to offer a manager's amendment in the form of an amendment in the nature of a substitute, and I'll ask the clerk to report that amendment.
Amendment in the nature of a substitute to H.R. 903, offered by Mr. Pallone.
Without objection, the manager's amendment will be considered as read. Let me recognize myself very briefly. The bill would allow dentists to be included in the national response to a disaster, including a natural disaster such as Hurricanes Katrina and Rita, or a man-made disaster like a terrorist attack. The manager's amendment contains two technical changes to clarify that HHS has the discretion to include dentists and dental facilities in the national response framework. Does anyone else wish to comment or seek recognition to speak on the manager's amendment? Seeing no one, does any member seek recognition to offer an amendment to the manager's amendment? No? Okay. What'd you say? Oh, this is a good moment in history. Well, I'm glad you think so. There being no further discussion, the question is on the manager's amendment in the nature of substitute. All those in favor will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the amendment is agreed to. And now we'll move to vote on the bill. I now move that the Subcommittee on Health forward H.R. 903, the Dental Emergency Responder Act, amended to the full committee with a recommendation that the bill pass. All those in favor will say aye. I need a stronger aye than that. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 903, the Dental Emergency Responder Act, as amended, is favorably reported to the full committee. Next, we're going to consider H.R. 1745, the Family Health Care Accessibility Act. The chair now calls up that bill and asks the clerk to report the title.
H.R. 1745, a bill to amend the Public Health Service Act to provide liability protection for volunteers, practitioners at health centers under Section 330 of such act.
Without objection, the bill will be considered as read and open to amendment at any point. The chair will recognize Mr. Green to offer an amendment in the form of an amendment in the nature of a substitute, and the clerk will report the amendment, and then we'll recognize Mr. Green.
Amendment in the nature of a substitute, H.R. 1745, offered by Mr. Green.
Without objection, the amendment we have to have, let's see. Okay, Mr. Green, this is your, without objection, the amendment by Mr. Green is considered as read, and I recognize Mr. Green if you'd like to comment on it.
Thank you, Mr. Chairman. The amendment I'm offering on behalf of Mr. Murphy and myself is a manager's amendment to H.R. 1745. The bill is sponsored by Congressman Murphy, and I've worked on with him this bill since it was originally introduced. Seems like many, many years ago. Mr. Murphy and I are strong supporters of the Community Health Center program. This legislation would improve access and increase services provided at FQHCs by extending federal tort claims protections to licensed volunteers at FQHCs. We've passed this legislation out of the House 2 other times, once during the 2008 Reauthorization Community Health Center program, and also in the House Health Reform Bill this year. Unfortunately, the provision stalled in the Senate both times, and Mr. Murphy and I are hopeful this bipartisan manager's amendment will allow the bill to move through the Senate. However, I'd like to ask the chair to continue to work with our staff on some technical issues in this amendment, as well as to limit the scope of services given under Federal Tort Claims Coverage Act in the amendment. I'm not 100% happy with this section of the amendment, but I feel we can come to a resolution with Chairman Waxman's staff, Ranking Member Barton's staff before we move to the full committee. And I hope both Chairman Blow and Chairman Waxman will continue to work with me. And with that, I'd like to thank Congressman Murphy and his staff for continuing their hard work on this, and I'll be glad to yield to him any remaining time.
Thank you. I thank the gentleman, and this truly is a team effort, and of course there's many of the members of this committee who also helped out on this as well, and I also want to thank the staff for working on this. There are some technical things we need to work on with regard to some Medicaid and some other coverage issues, just to make sure that the language is fine-tuned to help the community health centers. I also want to acknowledge a number of medical groups have also endorsed this, because they, as well as the community health centers, because they recognize they are really in dire straits of having enough doctors, dentists, nurses, podiatrists, nurse practitioners, psychologists, and this really opens the door. Many times we hear from doctors that I'd like to give my time, but I just can't afford to give it, and that's a strange sort of quandary they're in. But this bill with Mr. Green and I have worked out, I think, solves a lot of that problem, and this amendment in the nature of substitute cleans up many things, and I appreciate you, Mr. Chairman, the work you'll do, and Mr. Waxman help us work on this further. And with that, I yield back.
If I could just comment, Mr. Green and Mr. Murphy, obviously we'll work with you as we move to full committee. Does the gentleman yield back?
I yield, Mr. Chairman.
Okay. Does anyone else wish to comment on the Green-Murphy amendment? No? Okay. Does any member seek recognition to offer another amendment at this time to the bill? Okay. If there's no further discussion, the question is on the amendment by Mr. Green and Murphy in the nature of a substitute. All those in favor will signify by saying aye.
Aye.
All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment is agreed to. And now we'll move that the Subcommittee on Health forward H.R. 1745, the Family Health Care Accessibility Act, as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. Aye. All those opposed, no. Opinion of the chair, the ayes have it, and H.R. 1745, as amended, is favorably reported to the full committee. The next bill is H.R. 2923, the Combat Methamphetamine Enhancement Act. Chair now calls up that bill, H.R. 2923, and asks that the clerk will report the title.
H.R. 2923, a bill to enhance the ability to combat methamphetamines.
Without objection, the bill will be considered as read and open to amendment at any point. Does any member seek recognition to offer an amendment to the bill? If not, I'm sorry. Yes, Mr. Gordon.
Thank you, Mr. Chairman, for bringing this up. I rise today in support of S-256, the Combat Methamphetamine Enhancement Act of 2009. I'd like to thank you for bringing this important legislation to our consideration today. I'd also like to thank Senator Feinstein for her determination and diligence in the effort to combat the spread of meth. 4 years ago, Congress approved the most comprehensive bill to date targeting the spread of methamphetamine. It led to a decline in the number of reported incidents across the country, but criminals who cook and distribute the dangerous drug have exploited other loopholes in laws that regulate the sale of the precursor materials. As a result, we have once again seen an increase in distribution, use, and manufacturing of methamphetamine. Too many retailers and distributors of pseudoephedrine and other products are not in compliance with the 2006 law. Building on that law, which brought pseudoephedrine products behind the counter, this bill before us today would require all retailers to, again, register with the U.S. Attorney General, require distributors to these products to sell only to retailers who are registered to sell controlled substances, and require the Attorney General to provide a downloadable database on the website to all retailers who have filed self-certification, and clarify that retailers who neglect to file the required self-certification can face civil fines. This bill has been endorsed by the National Association of Chain Drugstores, the Healthcare Distribution Management Association, the Community Anti-Drug Coalition of America, the National Narcotics Officers Association, and the Fraternal Order of Police. Thank you very much, Mr. Chairman, for providing this amendment today, or for letting us vote on this today.
I thank the gentleman. Is there any further discussion on this bill? If not, I now move that the Subcommittee on Health forward H.R. 2923, the Combat Methamphetamine Enhancement Act, to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 2923 is favorably forwarded to the full committee. Next bill is H.R. 3199, the Emergency Medic Transition, or EMT Act. Chair now calls up the bill. The clerk will report the title.
H.R. 3199, a bill to amend the Public Health Service Act to provide grants to state emergency medical service departments to provide for the expedited training and licensing of veterans with prior medical training and for other purposes.
Without objection, the bill will be considered as read and open to amendment at any point. The chair now recognizes Ms. Harmon to offer an amendment in the form of an amendment in the nature of a substitute on behalf of herself and Representatives Sarbanes and Boyer. Clerk will report the amendment.
Amendment in the nature of substitute to H.R. 3199 offered by Ms. Harmon.
Ms. Harmon is recognized.
Thank you, Mr. Chairman. I've already discussed the substance of this amendment, as has Mr. Sarbanes. It is bipartisan. It was, I think, unanimously adopted by this subcommittee and committee during the health care debate, and I urge its prompt enactment.
Thank you. Does anyone else seek recognition to speak on the Harmon Amendment? Okay. Does any member seek recognition to offer an amendment to the Harmon Amendment? If not, there being no further discussion, the question is on the Harmon Amendment in the nature of a substitute. All those in favor will signify by saying aye. All those opposed will say no. Opinion of the chair, the ayes have it, and the amendment is agreed to. Now we'll vote on the bill. I now move that the Subcommittee on Health forward H.R. 3199, the Emergency Medic Transition, or EMT Act, as amended, to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 3199 is favorably reported to the full committee. Next, we have H.R. 3470, the Newborn Act, and the chair calls that up and asks that the clerk report the title of that measure.
H.R. 3470. This act will be cited as a nationally enhancing the well-being of babies through Outreach and Research Now Act.
Without objection, the bill will be considered as read and open to amendment. The chair will recognize himself to offer a manager's amendment in the nature of a offer a manager's amendment in the form of an amendment in the nature of a substitute. The clerk will report my amendment.
Amendment in the nature of a substitute, H.R. 3470, offered by Mr. Pallone.
Without objection, the manager's amendment will be considered as read. Let me recognize myself briefly to comment. The bill authorizes a pilot program to address a serious public health problem, infant mortality. The amendment simply makes minor changes to the introduced bill. The program would give grants to programs to fight this problem in areas that experience the highest rates of infant mortality. I wanted to thank Representative Steve Cohen from Tennessee, who's the sponsor of the Newborn Act, for his deep commitment to and tireless leadership on this important issue. Does any member seek recognition to speak on the manager's amendment?
Mr. Chairman, I do.
Mr. Shimkus.
Just to ask questions of counsel, if you may. Section 330H of the Public Health Service Act provides authorization for the Healthy Start Initiative. Is that correct?
The counsel.
Yes, sir.
Next question: the authorization amount for the Healthy Start program was $120 million for fiscal year 2008. For fiscal years 2009 through 2013, the authorization level for this program was the previous year's level plus an inflation increase. Is that correct?
Yes, sir.
Is the Health Resources and Services Administration, HRSA, as we kind of call, currently funding grants for this initiative?
Yes, sir.
According to questions, and this was a relatively late ad, so we understand that HRSA already provides intensive services tailored to the needs of high-risk pregnant women, works with individual communities to build upon resources to improve quality and access to health care. At the service level, ensures mothers and infants have ongoing sources, links mothers and infants to a medical home. At the system level, develops a consortium composed of neighborhood residents and requires strong collaborative linkages with state programs. What services will be provided under these pilot programs that are not provided under the Healthy Start Initiative?
You described those programs in more detail than I actually know, but the one.
Can I ask? I'd like to answer it maybe instead of counsel, because I think maybe it gets to be not so much a interpretation of law as what what we're actually doing here. The bill is targeted specifically on infant mortality and areas with the highest rates of infant mortality. Now, I understand there's other programs at HHS that are broader in scope, and so what the sponsor is trying to do here is tailor it more to those areas that have the highest rates. So I know that you can continue to ask questions, but I know that you and Mr. Barton have indicated support for the bill. But that's the distinction, if you will, between that and the current programs.
Yeah, and in our research, I think the HRSA focus goes to areas of high infant mortality. The point is, and we're not going to object, we're not making a big deal, but we are duplicating a program and service that's already provided with the direction that the intent of this is. It goes in line with, the opening statement, and the intent is honorable. We're not going to cause a big stir. It's just a point that has to be made. We're going to have to be careful about duplicating programs and services in areas that we already do.
Well, let me just say that I appreciate your and Mr. Barton's willingness to move on this, even though you disagree about whether it's necessary. Thank you.
No, I would say we agree it's necessary. We disagree with the duplication of establishing a program in which we're already doing it under HRSA.
All right. Well, there's a disagreement here, but I appreciate the fact that you guys are, still willing to move it as part of our consensus calendar. Any other discussion on this? Any other amendments that anyone wants to offer? If not, there being no further discussion, the question is on the manager's amendment in the nature of a substitute. All those in favor will signify by saying aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the amendment is agreed to. And we now move that the Subcommittee on Health forward H.R. 3470, the Newborn Act, as amended, to the full committee with the recommendation that the bill pass. All those in favor will say aye. Aye. All those opposed say no. The opinion of the chair, the ayes have it, and H.R. 3470, as amended, is favorably forwarded to the full committee. Next, we have H.R. 5710, the National All Schedules Prescription Electronic Reporting Reauthorization Act of 2010, or NASPR for short. Chair now calls up H.R. 5710, NASPR, and the clerk will report the title.
H.R. 5710, a bill to amend and reauthorize the Controlled Substances Monitoring Program under Section 399.0 of the Public Health Service Act.
Without objection, the bill would be considered as read and open to amendment. I'm going to now recognize myself to offer a manager's amendment. The clerk will report the amendment.
Amendment to H.R. 5710 offered by Mr. Pallone, page 5, line 24.
Without objection, the manager's amendment will be considered as read. Let me just recognize myself briefly on this. As I think has been mentioned, this is a bill sponsored by Ed Whitfield, but many members, including myself, Mr. Shimkus, Mr. Stupak, are co-sponsors. The state prescription drug monitoring programs track prescriptions so that states can identify and address drug diversion or abuse. That helps law enforcement. It also helps doctors and public health authorities prevent and respond to the potentially devastating effects of prescription drug abuse. The NASPR program was first authorized in 2005, and it lets the Secretary make grants to support these state programs. It also sets standards for privacy and interoperability. So the bill would reauthorize the NASPR program, enhance evaluation and reporting, and make other updates to the program. The manager's amendment is really just technical at this point. I don't think there's anything really to discuss. It's just a technical amendment. So I would anyone else like to talk about Mr. Shimkus?
Thank you, Mr. Chairman. We had a great hearing on this earlier this morning. It reauthorizes it for 3 years, for $15 million and $10 million the following 2 years. Great testimony, and I look forward to supporting the bill. You go back.
Thank you. Any other member want to talk about it? Yes, Mr. Burgess.
Just to point out that this is an example of how this committee can and should work. This legislation has been around for a while. Our colleague, Dr. Norwood, was one of the principal leaders on this, and he and his staff worked on this for years, and I'm grateful to see it's up for reauthorization, and maybe this time we'll get it funded. I'll yield back.
I thank the gentleman. Does any other member seek recognition to speak on this amendment? No? If not, the question is on the manager's amendment. All those in favor will signify by saying aye. Aye. All those opposed will say no. The opinion of the chair, the ayes have it, and the amendment is agreed to. Does any member seek recognition to offer any other amendment or speak on the NASPR bill at this time? If not, I now move that the Subcommittee on Health forward H.R. 5710, NASPR, as amended, to the full committee with the recommendation that the bill pass. All those in favor will say aye. All All those opposed say no. In the opinion of the chair, the ayes have it, and H.R. 5710 is, as amended, is favorably reported to the full committee. Next is the Train Act, H.R. 5756, the Train Act of 2010. Chair calls up the bill. Clerk will report the title.
H.R. 5756, a bill to amend Title I of the Developmental Disabilities Assistance and Bill of Rights Act of 2000 to provide for grants and technical assistance to improve services rendered to children and adults with autism and their families, and to expand the number of university centers for excellence in developmental disabilities education, research, and services.
Without objection, the bill will be considered as read and open to amendment. Chair recognizes himself to offer a manager's amendment in the form of an amendment in the nature of a substitute. Clerk will report that amendment.
Amendment in the nature of a substitute to H.R. 5756 offered by Mr. Pallone.
Without objection, the manager's amendment will be considered as read. Let me recognize myself briefly on this. The bill builds on the important work of the University Centers of Excellence in Development Disabilities Education, Research, and Service, also known as USEDS. Basically addresses the needs of individuals with developmental disabilities. Again, the amendments are merely technical. There's really not much for me to add. Okay, well, I should add this. Mr. Doyle, who I guess is, well, he's not on our subcommittee, I guess, right? Mr. Doyle, who we all love, he's the sponsor of this bill, and I just want to thank him for his leadership on the issue of autism and for authoring this bill. And we all know how much needs to be done on the issue of autism. He currently serves as co-chair of the Congressional Coalition for Autism Research and Education, and he's been a tireless advocate for the needs of people on the autism spectrum. So I wanted to mention that and urge my colleagues to support this amendment as well as the underlying bill. Does any other member seek recognition to speak on the amendment? Okay. How about any other amendments? No. If not, there being no further discussion, the question is on the manager's amendment in the nature of a substitute. All those in favor will signify by saying aye. Aye. All those opposed will say no. The opinion of the chair, the ayes have it, and the amendment is agreed to. We now move to have the Subcommittee on Health forward H.R. 5756, the Train Act of 2010, as amended to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 5756, as amended, is favorably forwarded to the full committee. And now we have H.R. 5809, the Safe Drug Disposal Act of 2010. Chair calls up that bill. Clerk will report the title.
H.R. 5809, a bill to amend the Controlled Substances Act to provide for take-back disposal of controlled substances in certain instances and for other purposes.
Without objection, the bill will be considered as read and open to amendment. I'll recognize myself to offer a manager's amendment in the form of an amendment in the nature of a substitute. The clerk will report the manager's amendment.
Amendment in the nature of a substitute to H.R. 5809 offered by Mr. Pallone.
Without objection, the manager's amendment will be considered as read. Let me recognize myself for a statement on this. Again, this is an Inslee-Stupak bill. We did actually have a hearing on this today as well. The amendment makes several agreed-upon technical changes to the Safe Drug Disposal Act of 2010. It clarifies that the mandated EPA study shall identify additional authority needed to carry out the study's recommendations if EPA determines that its existing legal authorities are insufficient to implement those recommendations. Does anyone else want to talk about the matters of that? Mr. Shimkus?
Thank you, Mr. Chairman. The hearing was good today, and to realize that the effects of prescription drug abuse really unauthorized by the public is a bigger risk and a threat than we know. This is a very important bill. This bill does not mandate that any entity establish a drug take-back program, though, but it does help use processes and folks to start doing that if they desire. It does require the EPA to conduct a study to determine the environmental impact of prescription drugs being disposed into water. Another issue that I know is of great concern to a lot of our colleagues. And I yield back.
Thank you, Mr. Shimkus. Does anyone else wish to discuss this amendment or offer an amendment? Okay. So we will, if there's no further discussion, the question is on the manager's amendment in the nature of a substitute. All those in favor will signify by saying aye.
Aye.
All those opposed will say no. The opinion of the chair, the ayes have it, and the amendment is agreed to. We'll now move that the Subcommittee on Health forward H.R. 5809, the Safe Drug Disposal Act of 2010 as amended, to the full committee with the recommendation that the bill pass. All those in favor will say aye. All those opposed say no. Opinion of the chair, the ayes have it, and H.R. 5809 is favorably forwarded to the full committee. Now, before we all leave, I would ask unanimous consent that the staff be authorized to make technical and confirming corrections to the measures forwarded at today's markup. Without objection, so ordered. And let me just thank again Mr. Shimkus and all of you on both sides of the aisle. You know, whenever you do these consensus bills, it seems like it's easy. I assure you it was not. We spent a lot of time, the members.
Mr. Chairman, we try not to make it easy, but the staff overcame even us.
All right. So I want to thank everybody. And there being no further business before the subcommittee, the meeting of the Subcommittee on Health is adjourned. Thank you.